welcome, and thank you for so much for joining the first Kinesis Innovation Center community meeting. I'm totally thrilled that you are here. It's a real pleasure to see the researchers, innovators, and clinicians and policy-facing colleagues gathered in one space. Because actually, what exactly we are aiming to, and Kinesis is all about, to connect people with and evidence to create real-world impact. This is our, let's say, initiative. Where I'm going to speak about community assets, collective impact. The Kinesis Innovation Center, let me please abbreviate KIC. Strategy at the science data point, definitely be more.
The Kinesis Innovation Center is dedicated to advancing movement, health, and digital innovation. We bridge research, technology, and policy to better understand how people move, age, and thrive. Through evidence-based science, secure data ecosystems, and next-generation digital health approaches, we create a space where ideas evolve into meaningful impact. Kinesis Innovation Center brings together experts, networks, and emerging technologies to shape the future of mobility, longevity, and human well-being.
I was speaking about our vision, where we see ourselves as a people-led European platform for physical activity and healthy aging and longevity, that we are built for global impact. This is a European, let's say, source anyway. The researchers has wonderfully, Michael said, way to what we aim to enable is to move from to build strategic alliances and to communicate, to activate the community, connecting the stakeholders around the scientists. So our architecture we build around thematic groups, and we aim to develop the virtual ecosystem, KIC virtual ecosystem. Kinesis Innovation Center, or KIC, is a forward-looking post-action sustainability project, as Michael said, designed to transform what we devoted, that we are dedicated in the European model, which is the open science, which is quite distinct. We may discuss at a later stage on another occasion what is the European model compared to the States and the China, perhaps, and other different territories, to enable innovation on physical activity and healthy age and longevity. We bring together the Europe's leading researchers and practitioners across different disciplines, spanning innovations, health technologies, and data science and social innovation for the whole lifespan of the human. So our vision is to turn evidence into action. Meaningful prevention, health promotion pathways, accelerating translational research, PPPs, private-public collaboration, and definitely policy-making, evidence-informed and supported policy-making. So we sit at the intersection of research excellence, community engagement, where people's network, as you may understand, we bring different, let's say, communities in here, and technological leadership to shape the future of active living and health aging. So, speaking of that, let me introduce the founders of the Greek Scientist Society. Greek Scientist Society is a non-profit organization. Professor George Chrousos is a member of the Academy of Athens and president of the Hellenic Pasteur Institute. He is also the president of the Hellenic Institute for Healthy Longevity, UNESCO chair of Adolescent and Health Care, a lot of hats. Just to tell the most important to my understanding, he's on top 250 clinicians worldwide in his field. And you've seen Michael Brach, Professor Michael Brach, chair of PhysicsNet construction, member of the GRAPPA, and works at the University of Münster Institute of Sport and Exercise Sciences. We have Professor Patrick Essers. I'm glad he's joined us. He's a professor at Oxford University and Oxford University, and he's the director of the Center for Movement, Occupation and Rehabilitation Science, MORS. And, perhaps some of you that I'm involved with the Greek Scientist Society. Networks join forces, as I said before, in order to develop a European by strength and alignment, but global by partnerships and ambition network to move on. So what we aim to enable is to move from projects to pathways and to establish a European movement to scalable impact. So we aim to translate science into practice, turn data into decision prevention services and programs that work in real life, embody, let's say, the European data agenda and work in all these fields. And you've seen that we structure one of them, one of our thematic groups around data to accelerate collaboration across academia, clinics, industry, and the public authorities, all the different stakeholder groups, build trusted adoption routes for data, interoperability, governance, data, metadata standards, compliance, and all these things, generate policy-ready outputs from evidence briefs, roadmaps, real-world validation insights, and enable pilots and test beds that prove impact and can replicate it across Europe and beyond. Europe to become a strategic pillar of health, resilience, and prosperity, to shift, to turn the knowledge into implementation, to make research usable for clinicians, the community, and the society at large, trusted ecosystem where data, technology, and governments work together to accelerate adoption, and the community that moves from alignment to impact. With alliances, pilots, real-world adoption, and things like that. Standards, compliances, interoperability, and definitely a European platform, but with a global ambition to translate the things and have some meaningful outcomes. So our architecture, the thematic groups, as you may have seen, is that we try to build around certain, let's say, thematic groups: innovation and technology, digital twin and data demonstrations, research publications and evidence gallery, clinical studies and real-world evidence hub, policy practice impact, citizen science and societal engagement area. It's interesting what they do at Dara Foundation, and capacity building we're going to have. And this platform is going to be used definitely for capacity building and skill centers for KIC. So there is the establishment of a KIC virtual ecosystem where we try to showcase all the things that we discussed before, and we, let's say, build around publications, grants. It's quite interesting for most of the, and I've seen that there is a lot of interest over there. Proposal collaboration as well, data, clinical studies, policy, and the general collaboration. And our pillars, we have our own, let's say, approach and architecture of a European movement. So we built not a project, not a network, but an infrastructure. What we do, we federate connecting actors and evidence into coherent ecosystem. We strategize, shaping direction upstream, in a proactive way, we collaborate this, let's say, a kind of collaboration, coordinated action across different sectors. We drive adoption, moving from research output to real-world deployment and measurable outcomes. We advance sovereignty. This is a huge issue, how we can turn, let's say, our data into meaningful, not for humans, but for the machines, federated mobility. We are in the big data, let's say, era, and we need to support and get meaningful results out of this. We shape regulation. We plan to be active on this field and catalyze funding, engage with policy. And our vision is not is to have these pillars as levers to elevate physical activity and healthy aging and longevity from a health topic to a European strategic issue that is built for global impact. A way to join, to shape open science, for training and capacity building, for active participation, to get involved in real projects, from clinical studies to citizen science, translation and commercialization, so to transform your research into impact, and we aim to develop guidance and mentorship. So join the community. Please invite your colleagues. We start building this ecosystem. It is quite important. We have a nice platform. The platform is there, and we are going to use it extensively in order to build our ecosystem around that. So introduce yourself. Use also our different channels like LinkedIn and get in contact, direct contact with us. Join the thematic groups so we can help co-design pilots, test beds, and translational pathways, and establish open dialogue. I'm going to share a poll in a while, what we should prioritize, the alliances, what we can contribute, and things like that. Thank you so much. Join our journey towards healthier lives and longer years of vitality. So thank you for your attention, and I'm happy to answer any questions you may have.